The reason that United Way is even involved in this discussion is that there are really three prime areas of public policy and grant making that we're involved in. The first one is education, where we're working very, very hard through the programs that we fund to increase the graduation rate in South Carolina and really across the U.S. And by focusing beginning at pre-kindergarten and up. The second area is to make sure that families have the kind of training and access to services that they have some sort of financial stability in their life. And we have some kind of definite criteria which we can define that. But the third, and I think, as the Congressman has alluded to, most important and most challenging because it affects the other two, is access to health care. And we have found that the difficulty here is that we're dealing with a long legacy of the unintended consequences of public policy. In fact, during the Great Depression, when the New Deal went into effect, the government froze the wages of the people who were working. And so companies, in order to recruit people, began offering free health care. And suddenly, that became the policy of companies. It wasn't just a temporary recruiting technique. And now, it means that if you have a job and you work full-time and you work for a well-funded organization, you have health care. And if you don't, you don't. And that happens to be the healthcare system. What we want to do now in this discussion around public health care is be aware of the fact that no matter what decision we make, there will be unintended consequences, and that is to minimize them. The issue here in South Carolina for us are really around the issue of chronic disease. If we were to just take the folks in this section of the room and say to you, congratulations, you have a chronic disease, you're going to die, and you're going to die increasingly painfully and increasingly using up your personal resources and public resources. That would be about the percentage, if you took everybody in the room, of the number of South Carolinians who have a chronic disease. It's 39%. And that number is what is beginning to overwhelm our healthcare system. And when you think about what those diseases mean, the number one happens to be in heart disease, currently cardiovascular disease. Number two, diabetes. And there are others, asthma, high cholesterol, other conditions which will contribute to somebody's, to our getting a little sooner to that 100% outcome on our eventual demise. But if we begin looking at the issue of prevention and getting to the problem before it becomes a problem, we feel that that's the first step. When it comes to the big picture, we're all going to have to give. And it really doesn't matter, insurers, business, government, political parties, all of us, we're going to have to give something to get to the big goal. But there is one thing that we can all agree on. If we can improve access to primary care and stop chronic disease before it starts, we're going to go a long way to solving our problem. 70 cents of every dollar that you and I spend on health care is spent treating chronic disease. And you know, if you really want to reduce our health care costs, we have to start there and move out from there. And there's also another issue from United Way's perspective, because we do community organizing, because we work to try to change communities on the ground. One of the most disturbing things to me about this issue of chronic disease is an issue of racial justice, because chronic diseases overwhelmingly affect minorities, and primarily in South Carolina, that's the African American population. More than 30% of the state's population of African Americans have cardiovascular disease. That's unacceptable. And it has to do, there are a lot of legacies and a lot of reasons around that, but for United Way, for us, this is a big issue, because our community is suffering from it, and we want to be a part of helping to change that from the community level. We're in it with you. We, as the Congressman said, we're aware that this is a hard issue. It's not going to be simple. But we believe through innovative thinking, through communities that are working together and are dedicated to each other and caring for each other, we really can make this work. Thank you.